Indeed for that, but we can speak now to Zainab Adishir, who's Chief Executive Officer and co-founder of PillSorted, specialising in delivering patients' medicines to their door. Thank you very much indeed for joining us, Zainab. Are you happy, in addition just to delivering the medicines, to actually make a diagnosis for people as well? It presumably puts you in a very difficult position.
Hi, thanks for having me. I absolutely am happy to make the diagnosis, but let me give you my general understanding of the plan. I think this is a fantastic plan, one of the best to get us towards that integrated, seamless care that everyone deserves. There is a survey mentioned in the plan that more than 90% of people are comfortable and trust the pharmacist to consult about their clinical needs and minor ailments. So we are very well positioned to be able to create that advice. The how-to that's been explained in the plan is great. So the expansion plans on the pharmacy have been very well thought. They're quite thorough, enabling the pharmacists to support prescribing medications for 7 common conditions like the urinary tract infections, insect bites, impetigo, sinusitis, sore throat. All of these are important initiatives.
Indeed.
As well as that, there is the blood pressure or contraceptives that we can do. But the most important thing is realizing the IT connectivity. So we have to develop that digital infrastructure to be, enable us to deliver that digital interoperable solution. So let me give you an example of the Yes?
Yeah, I was going to say that's all well and good. We've heard about digital initiatives with the phone systems in GP surgeries. But the King's Fund is saying that the problem for many pharmacies is, number one, they don't have the room for consultation areas or consultation rooms, and they haven't got the diagnostic tools to decide whether something is a minor ailment or something more serious.
So let's think of it as a patient point of view. There is a lot of initiatives by the NHS, for example, on the clinical governance that happens throughout the pharmacy contract to keep us enabled and trained towards all of these different conditions. Let me tell you about urinary tract infection. I understand that the diagnosis is super important. We have carried out that training towards the pharmacy quality scheme that we have to go through.
Yeah.
If we don't diagnose a urinary tract infection on time, especially in the elderly, it leads to sepsis, which is a hospital inbound, lots more danger to the patient and much more cost to the NHS. So let's think about it from the patient point of view. So all of these initiatives are super important. There is a lot of pressure.
Oh, I'm afraid we've lost Zainab there, but Zainab indicating, of course, that as far as she was concerned, obviously it is a positive from the patient's point of view, but apologies there, the link appears to have gone down. But certainly we got the main thrust of her point there. Coming up here on GB News Live, we'll have the latest on this huge barge to house hundreds of asylum seekers. It's a